Good Monday afternoon. Thank you so much for joining us. I'm Jeff Talon. The government shutdown is marching toward the dates for the Affordable Care Act's open enrollment season. This year's enrollment period is sending sticker shock for those who rely on it for coverage. President Joe Biden expanded subsidies for the ACA in 2021 during the pandemic. It widened the range to middle-income earners who can get a tax credit to help pay for their premiums. It allowed a family of four making just under $130,000 or a couple making just under $85,000 to receive a cap on premium costs. But that expansion ends this year, meaning unless Congress acts, people making those amounts or more will have to pay full price.
A Marathon County constituent whom I met with recently, Keith anticipates that his family's premiums will go up from $9,000 a year to around $28,000 a year if these tax breaks aren't extended.
Democrats, like Senator Baldwin, are refusing to separate either making permanent or extending these tax credits from the passing of the federal budget. Democrats are blaming the shutdown on Republicans for refusing to work with them on that front. Republicans are blaming Democrats for refusing to separate that issue from the budget. So no matter which side of the aisle you agree with, the reality is increases are on the horizon for those self-insuring, as well as for those who get employer-sponsored coverage, though not to the same degree. News Channel 7's Emily Davies joins us now live in studio to explain what this means and what you can do about it as you're signing up for care for the next year. Emily?
Yeah, Jeff, no matter where you're getting your insurance, there's a bit of a domino effect in how insurance companies, healthcare providers, and patients or members are impacted. For a better understanding of the impact and options, I spoke with the leaders of two companies, a wealth management organization and one company who calls itself an alternative to the traditional healthcare system. Like just about everything these days, healthcare has been politicized. Something everyone can agree on.
The healthcare system in this country is broken.
The Affordable Care Act has allowed for more people to be insured than ever before. The expansion increased that and allowed for overall healthy, medium-income people who may not have been able to afford coverage to join. Those healthier individuals help share the cost for heavy users of healthcare. And that helps everyone because the companies on the ACA's list are also the companies offering employer-based programs. Even still, employer-sponsored coverage has increased 6 to 7% each year for the past decade. Brian Woods with Nomi Health says those increases are essentially inflation in healthcare costs on top of more demand for healthcare services, in part because of more people having coverage. But that wouldn't explain the jump in costs if the ACA subsidies aren't continued.
So if subsidies are going away, there's an expectation that the people who are going to continue purchasing coverage really need that coverage.
Insurance companies are anticipating healthier people just won't sign up.
Which means that those who are paying for the insurance coverage are seeing their costs escalate fast.
He says it's up to you to evaluate your personal situation as to whether to purchase coverage, but you could wind up in life-altering debt. CEO of Exit Wealth Advisors, Justin Farmer, says unless you're a multimillionaire, signing up for something lowers that risk.
Even if you choose a very high deductible, and the smart way to play that is participate in an HSA, so that if something does happen to you, then you've got those dollars saved and investing.
Woods says use your covered preventative services in your plans, too, to try to stay as healthy as you can. Now, Woods says if an employer option isn't an option, or whether it's your spouse's or yours, there aren't a lot of other things outside of this year's dozen ACA options in Wisconsin. But he says sometimes faith-based organizations or community groups also offer some coverage.
Emily Davies.